Good afternoon. Thank you for joining us for today's webinar, Tired of Turnover? Making Care Staff a Destination. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1 continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those of you who have provided us with your unique NAB number, and I will be sending attendance certificates as well. A survey will be launched at the close of the webinar. Your feedback is important to us and our speakers. Please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions and comments when asked throughout the presentation using your questions pane on the right hand of your screen, and our presenters will address them. Today's webinar is being presented by Robert Crowe, founder and CEO of Matchwell, and Bree Becker, Matchwell's Director of Clinical and Quality. I'll now turn the webinar over to Robert and Bree.
Great, thank you so much, Wendy. And I think we're going to turn on our webcams, so we'll do that now. So thank you, Wendy, and thank you everybody for joining today. My name is Rob Crowe, and I am the founder and CEO of Matchwell. And I think everyone here today is hyper aware of the challenges in accessing new care staff. And unfortunately, that's a webinar for another time. But I also think everyone here is aware of the challenges in retaining care staff. And that's what we want to dig into a little bit today. So despite all of us feeling the pain of care staff turnover, more often than we would like, we see organizations who simply keep doing the same things they have always done. You know, they recruit, they experience turnover, they recruit again, and the cycle continues. Because we're so used to high turnover in this industry, especially with care staff levels, how often do we allow our actions, whether directly or indirectly, send a message that care staff is by nature a transitionary position, within our organizations? How often do we applaud programs that focus on care staff development as a stepping stone into maybe another role? But then is there this message that gets sent to the rest of our workforce that if you're not care staff that is taking advantage of that career progression, you are somehow less valuable to the team? Today, we want to challenge the status quo a little bit and kind of talk about making your care staff positions a destination where people actually want to be, where they feel valued, and where we as organizations get the most out of them in providing great care for our residents and our patients. So let's move to the objectives. In today's session, we're going to focus on 3 primary areas. First, we'll contrast kind of retention versus engagement. I will tell you a little hint, these are not the same thing. Number 2, we'll look at a few national trends. After all, and I'm a data junkie, but data doesn't lie. And then finally, we'll kind of talk through some evidence-based practice techniques around employee engagement. So as I mentioned, I'm Rob Crowe. I am a 22-year veteran of the recruiting and staffing industry. I'm also a frequent advisor, panelist, and speaker on workforce trends. Essentially, back to the junkie part, I'm a workforce junkie. And I could feel, even through the webinar, many of you cringe when I use the word staffing. So don't worry, I did leave the healthcare staffing industry to actually help healthcare organizations build and access their own flexible workforces without an agency. And yes, I used to be clean shaven and I wore a suit every day, but when you leave an industry to tear it down, sometimes you have to go incognito. And then we also have Bree with us. So Bree, would you like to introduce yourself?
Yeah, thank you, Rob. So hey, everybody, and thank you so much for giving us the honor to spend the next hour with you. I'm really excited to share information and just some of our experiences. I have been in healthcare for almost 2 decades now. I'm a nurse practitioner, and I'm currently the Director of Clinical and Quality for Matchwell. But I also still work PRN at a large healthcare facility system here in Atlanta. And throughout my career, I've created and implemented leadership and engagement programs for one of the largest healthcare systems in the US. And so I kind of fell into it when I started climbing the leadership ladder at my organization. And I too have also worked as a panelist for leadership development, specifically in women and youth. So Rob considers himself a workforce junkie. I'm an engagement junkie. So by nature, I love building relationships. It's what brought me into nursing. And having worked in direct patient care and also on the administrative side of healthcare, I've seen both sides, and I've seen where both sides are being asked to do more with less. And like Rob said, we're stuck in this vicious cycle of hiring and training and hiring and training. So I get the fun part of the presentation. I get to share with you some of the creative solutions I've seen work over the span of my career, and hopefully I can give you a couple of practical takeaways that you can bring back to your organizations today. So now I'm going to hand it back over to Rob so he can start to dive into some of the data.
Excellent, thanks, Bree. So let's start with this first slide. There was an article that just recently came out, and I can tell you I was reading it first thing in the morning, and I almost dropped my coffee with a what the heck is going on here? And this stat of, I think it was more than 95% of workers are thinking about leaving their jobs, and more than 92% are thinking about changing careers completely. Yes, we're seeing lots of different articles on this topic right now. Some articles may not have quite as high numbers, but they're all very high. And I think it's kind of sending this message that as these organizations are surveying people, they're basically raising their hand and they're saying, we're not necessarily happy with our current career, employers, and/or position. And let's think about that for a minute. I think about what's happening just in general. So not just healthcare, but across all different workforces. And I find that we're at this fascinating moment in time. Technology, has changed the way that we work. It has given us instant access to lots of information. It's changed how we communicate and how we engage with each other. But what it's also done is it has blended what used to be work and life. So even in healthcare, where many of us work in a building, hands-on with patients, like, do you ever really leave it behind? And so I think just overall, it's kind of all compounding on all of us, and that includes our caregivers. Then you layer in this pandemic, and I think the pandemic was a big reset button for a lot of people, in thinking about life priorities, life satisfaction. What does work and life look like? How do, when I'm evaluating where I want to spend my time, where do I receive value? Where do I provide value? These are questions that many people were asking pre-pandemic, but I think the pandemic has really elevated the nature of these conversations. And we need to think about how our care staff are internalizing each of these questions themselves. And so, of course, the challenge was there was not enough care staff to go around before the pandemic. But now you start looking at this, and we're looking at this burnout thing. And guys, burnout is real. Being scared is real. The stress of this past year and a half and counting in our buildings, like, this is real. And so we need to kind of understand what this is head on. So now we go back to that stat and say 92% of people are considering a career change. This should keep us up at night. And sadly, many of us are almost too comfortable or too familiar with high turnover, maybe already in this range among our care staff. So let's kind of talk about the retention versus engagement. A couple things. One, you may be asking, how are these things different? Well, retention, think of retention as the lagging indicator. It's a static measurement of your workforce turnover. It is simply a number. It's a statistic that you can compare to other organizations and basically say, hey, I'm doing better or I'm doing worse than somebody else in retaining my staff. In a way, retention is the measurement of the level of employee engagement that you have at your organization. Engagement is that action. It's dynamic. It is the action of connecting. It is the action of creating a positive work environment. It is the work that goes into each and every day helping your employees do their best work. It is not about employee happiness. It's about employees wanting to do good work and you creating an environment where they can do that. A recent article called The Right Culture, not just about employee satisfaction, I think says it perfectly. Quote, employees who are engaged consistently show up to work and have a greater commitment to quality and safety and obtain impressive organic growth for their organizations. Essentially, these are employees that add value. They don't just show up, put in their hours, and go home. They show up and they care. They show up and they do good work. They show up and they have a role. They're part of your organization. They're not just a statistic that a retention stat would show. And because the lack of employee engagement is incredibly impactful for all of us, we looked around and we found a Forbes article, and this analysis was actually found that the lack of engagement cost employers almost $500 billion per year in lost productivity. Now, this is across lots of organizations, and by that, we're looking at 37% increase of people not showing up for work, 18% productivity loss when they are at work, and an average of 15% profitability that hits our bottom lines. Of course, Forbes did not take the extra step and start looking at, okay, what happens if we start layering in the pain of the staffing agencies that we have to now hire, or all that overtime that we're pushing on our existing workforce, or other premium pay. Sometimes I'll call it bribery pay. I'll give you $100 if you show up on Saturday. And, I think, unfortunately, many of you know what I'm referring to here. And by the way, that pushes them into overtime on top of that. And so, we have to kind of look at this. There's a lot more in getting our shifts covered. And then, of course, that's not even to mention the admissions that we had to maybe postpone because we didn't have the staff in the first place. So let's look at some data here, and we'll kind of move quickly through this. But CNAs are estimated to make up just shy of 40% of the overall workforce. And when I say overall, that's clinical and non-clinical combined in our buildings. Yet they provide about 80% of the direct care to our residents. For some of you that may be more on the assisted living side, just substitute CNAs for care staff of other types. These are the faces of your organizations to your residents. These are the relationships that are formed that make or break your residents and their families' experience with you. And so when you think about a subset of the workforce actually representing you to the majority of your patients, like or your residents, this is worth kind of taking a moment and thinking about. And yet, on average, let's go to the next slide, Bree. On average, a survey from across 3,500 skilled nursing facilities showed that they could only hold on to their nurse aides 53% of the time. So if you're doing the math, that's a 47% turnover within the first 12 months. And the trend actually goes down from there. Another 59% were out the door at some point in the second year, et cetera. And those costs do add up. And I know I'm preaching to the choir, but we're kind of wallowing in the pain a little bit so that Bree can, save us from ourselves. But, you think about the cost just to post, just to find that new person, let alone onboard them. And the survey that we were looking at said the average cost was about $2,500. That's just to get access to the person. That is not thinking about, again, all that agency and overtime and lost man hours from that turnover. So the true cost is actually higher. And for contrast, on average, that's about $1 per hour in wages to every single nurse aide that we have, just to kind of keep up with their own individual replacement. You start looking at this on scale and it starts to add up. So if you have 20 buildings, and Bree, go to the next slide here. If you look at about 20 buildings, you're looking at north of $500,000 per year in hard cost, simply replacing your care staff year over year over year. And again, that's not including all those other costs that we already talked about. But as I mentioned a moment ago, we did not set up this webinar to share the doom and gloom alone. For most of us, we can actually reverse some of these retention statistics through a little extra attention to engagement. What if we actually took a fraction of our time and a fraction of the energy spent searching and onboarding for new care staff, and we used it to actually train our teams on how to engage? Do we accept the status quo of turnover, or do we actually invest in dismantling the status quo? And I can tell you, as leaders, we are here, and by we, I also mean you. We are leaders in this industry because we refuse to accept the status quo as the only way forward. So Bree's going to actually share 5 specific areas to evaluate your organization's engagement. And our hope is that you'll see value in even just a few of these areas that you might be able to successfully weave into the fabric of your communities to impact some of this retention. So Bree, what can we do?
Thank you, Rob, and thank you for setting me up with all the doom and allowing us to wallow in our pain, because I think it hopefully will get us ready to hear some good news. Before we jump into engagement, I do think it's important to point out what big barriers to engagement can be. And first, and the biggest that I've seen over my career, is thinking that it's the sole responsibility of one department. So I think we all know when we think of retention, when we think of engagement, our first thought goes to human resources. That's their job. And really what the literature shows us is that it's everyone's job. So it starts from the CEO all the way down to the bedside staff that's training the new employee. So we all have our role that we can play in engagement. And if all roles aren't involved and they haven't bought into the program, it's likely that the program will fail. So no pressure, but it's a hefty job. It's a big lift. And also, over my career, I've seen that sometimes we make engagement programs too complicated. So maybe staff isn't even aware that there's an engagement program, or they can't follow it. They can't articulate what the program is when they're asked. And then we also see that we tend to focus on incorrect metrics. So like Rob said, we do tend to get hyper-focused on our retention stats. And there's organizations that have great retention, and that they see that and they say, well, our retention rate is great. We have good engagement. And that's not true all the time. And then relying on surveys, these kind of reactionary surveys that create these Band-Aid solutions. So maybe just before the state is going to show up at our organization or the Joint Commission, we send out this staff survey so that we can kind of, get an idea of what they're thinking, how they would respond to certain questions. And so not to start off completely negative, but just to say, let's be a little cautious when we're thinking about our engagement programs to avoid making it too complicated, looking at the wrong metrics, and not overusing surveys. So I think that's really important. The other thing I think that is vital to engagement programs is empathy. And I'm sure you're all familiar with empathy, the definition. It's just our ability to understand and share the feelings of another person. So I do think it's vital when we're creating engagement programs that we see and experience our organization through the lens of our care staff. Those are our frontline workers. So what I wanted us to do, and if you could use your questions box to just answer, I want us to go through a quick little exercise that I call See, Hear, and Feel. And there's no wrong answers. This is just to kind of get our creative brains working. But I want you to first throw in the questions box. What are things that your care staff see on a daily basis that could either contribute to engagement, or maybe it could contribute to disengagement? So, one to kind of get us started is thinking about where the world I come from in the acute world is constantly seeing people at their worst, seeing sick patients. That is something that can definitely cause care staff to disengage with an organization. So what are some things that you guys see that contribute to that? You can just throw your answers in. And then I want you to also think about what are some things that they could possibly hear that would contribute to either engagement or disengagement. So some things that come to my mind are, you know, gossip, crying. If you work in an area where maybe your residents are, you know, a lot of them are people living with Alzheimer's disease. And so do we have, you know, a lot of miscommunication and a lot of confusion on the unit? So what are some things that they can hear within the walls of your organization that could contribute to either engagement or disengagement? We could be good or bad.
Okay, so we have a couple coming in. I can read them off.
Perfect.
So for the first one, seeing director involvement or lack thereof, COVID, seeing their non-clinical peers and leaders helping wherever they can, happy residents contribute to engagement, seeing other people call off, long-term care people, or yeah, I guess this would be residents passing away, laughter contributes to engagement, too much change. Here's one. If care staff keep hearing their leaders talk negatively, they tend to feel the same, and it wears off onto the seniors. Family complaints and feedback. Medical challenges, cognitive impairment residents, leadership setting the example, positive or negative comments and praise. Disengagement, other staff, negative and burnout. Engagement of upper management on the unit. Cliques, not being included versus all working together. Recognition and appreciation. Acuity of residents. Negative comments, abuse from family members. Negative comments from media regarding nursing facilities. And those are the ones we have in so far. So if there are any others, please feel free to type them in.
I think those are great examples, and there's a couple of things that stand out to me, and honestly, some of you have already, you created my presentation for me. And a lot of the things that we're going to talk about today are what is it that we do as leaders that either contribute to disengagement or engagement. But it also, I think the things that you all have shared are just incredibly powerful in that it shows the impossible job that you're being tasked with, that there are just so many variables that either contribute in a good way, but a lot of what you shared are things that, you know, really do contribute to disengagement. So when you think about burnout, change, I mean, this is the year of change, right? Every day we're hearing something new about how we should be practicing and what we should be doing. So based on that, what you see and what you hear, so just give me a few things that your care staff may be feeling then based on that feedback that you've provided. And I know Rob, you know, when he started off, he talked a lot about the anxiety being so real and the stress and the fear. Those things are all, those are the lens that our care staff are seeing the world through right now, healthcare and, you know, just everything. It's not just in healthcare, right? There's so much unknown. And it's a really complicated task to engage such a range of experiences.
Okay, we have a few coming in. Unappreciated, stressed, burned out, fatigued, feeling like getting into a different line of work, which was another There's another one, feel like they want to leave the industry. Emotionally, mentally, spiritually, and physically exhausted. Overwhelmed, which goes with that one as well.
Yeah. It's all too real, but it paints the picture of what we're experiencing day to day. And even in the midst of that, just to give yourselves a pat on the back and to feel proud about what you're doing, even in the midst of all of those things, you are also choosing to show up, and your care staff is still choosing to show up and care for your residents. So hopefully, my goal is, one, I want to keep it simple, because I think you all, that activity and empathy just showed us how complicated engagement can be. And I think this picture also shows you all the different pieces that are moving. It's this constant cycle where we're always having to think about our staff well-being, because if they're feeling overwhelmed and exhausted, that contributes to it. And then we also have to think about productivity. We have to think about our, customers. It's just a cycle, and it could be very, very easily to go into this and to overcomplicate it. So I want to keep it simple. And I also don't want to just throw research in your face and say, here's what the literature says that you should do, because the truth is that's not helpful. And then also, you can read this information on your own. And I think Rob has already shown us how painful retention and engagement stats can actually be. So my goal is to highlight components that have resonated in the literature with me and what I've seen work in my 2 decades in the healthcare industry, and more importantly, give you some practical, tangible tips that you can take away today and potentially start implementing as soon as tomorrow. And I do want to caution you, nothing is a cure-all. And so if you are hearing from other organizations that, I've got the silver bullet or I have the answer, it's simply not true. It's going to be a variety of things. We all need tools in our toolbox or your tool belt, whatever you carry around with you, for different situations and different circumstances. So first, let's start here. I think this is a great image that depicts the shift in what employees are starting to look for. And the interesting part to me is that I've experienced this evolution in my career, and I've seen the real life transition of the workforce starting to evolve. My first job right out of college, it was all about my paycheck. It was all about what can this organization do for me? And at the end of the day, it was simply a job. And now, as I've grown in my career, I've had the privilege of working for several organizations, Matchwell being one, where it's about having a purpose. There's more of a focus on my development. I have a great boss who is also a coach, and it's not someone that I just interact with when I need to be reprimanded, but it's an ongoing conversation. And we have to start shifting the way we think about this, because that is what more and more healthcare workers are wanting. So we have to be able to evolve with it. So the simple first step, I think, is just to be present, show that you care. I spoke to a large group of nurses out of Arkansas, and I asked them, if there was one thing you could change about nursing, what would it be? If you could change anything about your job, what would it be? And shockingly, they said, make leadership care about me. And I thought that was so interesting, because even as a nurse, I was expecting, okay, more pay or safer staffing ratios, but really they just wanted to feel cared for. And we know literature shows that 69% of employees say they would work harder if they knew that leadership cared. And most of the time we do actually care. Maybe I'm a bit of an idealist, but I don't think that anyone here today went into this industry because they wanted to make millions, right? We go into healthcare because by nature we are wired to care for people. We are wired to care. But we get busy, we get caught up in the minutia, and sometimes we don't know how to show it, or we don't know how to show it to such a large group of people who, as you've, in the first activity, have such a vast different experience and lens every time they walk into our organization. So how do we show that we care? So there's 2 programs being implemented here in the Atlanta area across several large hospital systems that have shown to be really effective in communicating just that their organization cares for them. So the first is a crisis intervention program called Code Lavender, and it was developed out of the Cleveland Clinic. And it's a simple program to implement, fairly inexpensive, and basically what you do is you identify what is a response team. So if you've ever worked in the acute world, you know we have code blues, we have different codes, and that means that an identified group of people are going to come and respond to the emergency. So a code lavender is the same way. So it's made up of maybe a chaplain, a social worker, a manager, or even just a staff member who's a really good listener. And this team can be called upon to respond to real-time stressors that occurred during work, or so it could be from the death of a resident or a patient to just a care staff member showing up to work and feeling upset. And so this identified group responds, and they spend about 15 to 30 minutes listening and focusing on relaxation techniques and mindfulness techniques with the care staff member. And so systems that have been deploying this program are seeing great results and getting lots of positive feedback from their staff. So again, it's not a cure-all, but it is a very simple way to respond in real time when your care staff is experiencing stressors at work. And then the next one, which is interesting because one of the things that I wrote down with our activity is, lack of engagement from upper management or even director involvement, which, lack of involvement or just seeing a director involved in kind of the day-to-day can help with engagement. There's a healthcare system here that's implemented a program called Walk the Halls. And this is where every day their leadership is encouraged to come out of their offices and just interact and spend time on the unit with their frontline staff. And again, this is not supposed to be, because I think the thing we have to be cautious about, and what I have seen happen sometimes with programs like this, is leadership gets too involved, and so then you end up burning yourself out, right? So what should be a 30 to 45 minute walk the hall, spending time with your staff, ends up being you work an entire shift and then go back to your office and do your 10 to 12 hours worth of work. And that's not what we're talking about here. But it's just maybe spending 30 minutes a day where you get out of your office and you go and you spend time with your care staff with no specific agenda. You could help with different tasks or maybe just spend time, talking to them. And then I think that paying attention that goes along, or being present goes along with paying attention. And especially with like a program Walk the Halls, you want to interact with your care staff, but you want to do it in a meaningful way. And one way to do this is through a 3-step communication technique. And I learned about this early in my nursing career, and have found it not only useful when I'm talking to my peers, other colleagues, but also when I interact with patients. I use this all the time, and it's really simple. You ask, so the goal is to ask open-ended questions versus kind of biased or yes/no questions. And what this allows is for you to get more information, and helps you to quickly identify kind of what's going on and what is the person on the other side of the question actually thinking. And then listening. So this is, pretty basic, right? Like we all know that we should listen. And I know what I'm guilty of is I know how to look like I'm listening. I know how to make eye contact. I know how to nod. But often what's happening inside my brain is I'm thinking about, one, how I want to respond, and I'm not really listening to understand. And so using my own mindfulness techniques of when I'm having a conversation with someone, when I've asked them an open-ended question and they're taking the time to actually tell me what they're thinking, what they're feeling, I need to listen to understand. And sometimes that means I may not have an immediate response, and that's okay. And that goes along with validation. So often people just want to feel that they're heard. It doesn't mean that you agree with them, but what it does mean is that to you, their opinions and their feelings are valid and they're worthwhile and they matter. And that's really what a lot of us are looking for. And so with these 3 steps, once they help you start building rapport with your teams and among your colleagues, then you can implement just these different avenues to provide feedback. So you've kind of set the framework in how that feedback occurs. And so you can have focus groups. These are a great way to bring different disciplines together, particularly care staff, and share their experiences and even practice tips with one another. You know, maybe you have a nurse aide who works with Miss Smith who has dementia, and maybe, you know, typically she has a harder time in the evening hours, and so this care staff can share with her peers or his peers, here's some things I do with Miss Smith to help. And overall, what this does is it helps your care staff to become more engaged with each other, with the residents within your organization, and then your organizational culture overall. And then I think, importantly, providing purpose, right? The framework of our workforce is changing, and we know that it's not this one size fits all. And like I shared in the slide earlier, we're seeing this change of people starting to think less about their 9 to 5 as a job, but we're looking for how can we have a greater purpose, especially in healthcare. That's why a lot of us enter healthcare, because we want to, at the end of our life, say we did something that matters, we did something that impacted people's lives. And money's not always an incentive, you know, provide a purpose, not just a paycheck. Now, with that said, we know the elephant in the room is that money does matter, right? We all want to pay our bills. We all want to be a little bit more comfortable, and that's what money affords us. So you do have to pay competitively, but the thing to remember is there's always someone or an organization that will be able to pay more. So your pay can't be where engagement ends. So you want to think about ways you can engage with your workforce differently. So find out who's on the other side of your mission and what is it that inspires them. And so I've listed for you a few different demographics that, you know, it helps us to provide some contextual generalizations. I don't think that, you know, you can say just because someone falls into this demographic that you know everything about them, but it's a place to start. You know, when you think about parents, moms, so that is a demographic that is usually not as utilized as it could be, because, you know, we're all looking for those full-time workers. But if you have someone who wants to be a stay-at-home parent, they don't want to work full-time, but maybe they would be willing to work 1 shift a week. Your retirees, so the silver tsunami that we've all heard about that's happening and it's going to continue happening, this is a vital group in our workforce and in healthcare, and we cannot afford to lose them at the rate that we are. Now, I will say they have served valiantly and they do deserve to retire, but we're losing decades of experience and expertise that our younger workforce needs to benefit from. We can't lose that all at once. So maybe they do want to retire because they have earned it, but maybe they would be willing to do 1 shift a week, or maybe not a full shift, but 4 or 8 hours. How can we thread them into our workforce so that we're not completely losing them? And then millennials, you know, we know millennials, they're not typically defined by their job. They work to play. They want that lateral movement. They want to try different things. So the takeaway here is that we all tend to be so hyper-focused and desperate for full-time staff. And we know that that's what you want. But we can reframe it and start thinking about these underutilized demographics, because we don't want to lose opportunities to engage with these great workers, because there are some great workers within these demographics. And I know it sounds counterintuitive, but if you could keep a retiree for 25% of the time, that's better than losing them altogether. And I pulled this quote here from an article because I think it highlights the truth that we all need to hear, that doing what is best for employees does not have to contradict what is best for the organization. So it gives us a little bit more room to be creative and to find out what drives that person on the other side. And then empowerment. I think this is huge, and you've probably heard a lot of talk about empowerment, especially in healthcare. And ironically, the Joint Commission published a quick safety report July of 2019, so this was before the pandemic, calling on healthcare organizations to not only foster resilient workers, but to also take ownership in being a resilient organization. And so one of the things that they highlight are these leadership empowering behaviors. And one of those behaviors is workforce autonomy. So providing an avenue for your workers to mold some of the policies and procedures of the day-to-day so they feel like they have a little bit more power and a little bit more say in what they're doing. And honestly, what's so cool about this is that you honestly get better feedback because you can miss some of the barriers and some of the landmines that you might step on because the frontline staff is telling you by their experience what works and what won't work. And then flexibility is also a huge topic right now. The flexible workforce is one of the fastest growing workforces in the US, and so that's just our new reality. And the flexibility, you know, this also empowers our healthcare workers. It gives them some modicum of control, and there's different ways you can do that. You know, it's not a one size fits all. There's job sharing where maybe you have one FT that's split between two different workers. You can have float pools or flex pools where you've got these identified staff that are trained and they respond when you have needs. So there's lots of different ways to do this. One that I read about recently that I thought was really interesting, there's a hospital in Oklahoma who started a weekend plan. And when I first read it, I thought to myself, well, that's just crazy. How are they able to do that? So what they're doing is they're paying nurses for 72 hours of pay for only 48 hours of work if they'll work 4 12-hour weekend shifts every 2-week pay period. So it took me a minute to like wrap my mind around that. But what they did is they did some math and they found out that we could overpay these employees and we are still saving money because there's less overtime, I'm using agency less, and I have less turnover. So I'm not saying you have to pay your workers 72 hours of pay for only 48 hours of work, but it's just a great example of how one healthcare system used math to think creatively outside the box. But there's lots of ways that you can incorporate flexibility. It doesn't have to be a one-size-fits-all. And, you know, empowerment is your friend. Sometimes as leaders, we worry that we will lose control if we're empowering our employees, but it's actually quite the opposite. We're able to solve problems more creatively and effectively, and we're also engaging with our workforce more effectively when we are empowering them. So it really is a win-win all around for all of us. And then finally, I think it's important that we remember we need to have fun. You know, none of us have all of the answers and none of us are going to get this right all of the time. So as leaders, as healthcare workers, let's try not to take ourselves so seriously. Let's laugh at ourselves when appropriate. Some things that I've seen organizations do, you know, oftentimes when you go and you look for jobs, we see sign-on bonus, sign-on bonus. There's organizations that have flipped that and they focus now on retention bonuses and retention recognition. What are things that they can do to award the staff that have stayed within the organization? As a nurse, I know it sounds kind of silly, but luncheons, specifically like on the holidays, I can tell you I have worked many Christmases and absolutely I would much rather have been home with my family. But being with my work family, I have some of the fondest memories, and that's because the organization made the holiday fun. Now, yes, patients were still sick, and there was still, you know, that's just how healthcare is. You know, bad things still happen on the holidays. But I can still look back, and it was not a terrible experience because I knew that I would have time with my work family. And then threading humor when appropriate into everything, I think is so important. Don't take yourself so seriously as a leader. Be able to laugh at yourself. One of my favorite quotes, and I'm sure you've heard it a lot, is, you know, the only way to get through life is to laugh your way through it. You either have to laugh or cry. I prefer to laugh because crying gives me a headache. And it is true. There are days where especially in staffing and trying to balance a schedule and figure out how am I going to make sure that patients have what they need and staff have what they need. I literally would want to cry. But that, again, it doesn't serve me. And then lastly, when you think of play, and this is especially for our leaders here today, be a coach. Think of yourself less as a boss, more as a coach. And when I think of play, I think that obviously we don't want just people running out on the fields and just doing whatever they want. There has to be a point person who's in charge that's kind of giving us the guardrails. And to me, that's what a coach is. And it's also creating this environment where mistakes are an opportunity to learn. It's not always just a slap on the wrist. One easy tip that, and many of you may have heard this and use it, one tip that I learned early in leadership when I need to provide feedback is what is called the Oreo cookie method. So you provide a compliment, you coach, and then you provide a compliment. So I have lots of real life examples of how that's been used on me because I do have a lot of room for coaching. One particular, just to give you an example, so I remember I sent out this large email to the organization and my boss came to me and said, Bree, you're a great communicator, very concise. You may want to soften your language a little bit in the email because it came across a little stern, but great job. Great job drafting the email and being concise. And so, how would that have gone if she had come to me and said, your email came across really curt and you need to send an apology email immediately? Just how that went, one, I was able to learn. And it's something to this day that I still think about before I hit send. Is there anything I need to massage or soften? And two, it made me feel, it empowered me that I'm not going to be perfect all the time, but I'm still contributing to this organization and I still feel like I'm valued. So I think that's just, one of my real life examples, and I have many more if you want to talk offline. So overall, just remember, we want to be present, we want to pay attention, we want to provide our care staff with purpose, we want to empower, and we want to have fun. But we also need to keep it simple. So thank you again for allowing Rob and I to share with you not only our research, but our experiences, and hopefully you've identified a few ideas you can take back to your organization to help you move your workforce into the future. So we wanted to open it up now for just any questions or comments if you have any.
Great, thanks Rob and Bree. This was great information that you shared with us today. And at this time, we will open up the question and answer portion. So please type your questions in the question box on the right hand of your screen. And we do have something in that we can get started with. The challenge we are seeing is that we tried rolling out similar programs, but right now we are so short-staffed that there isn't that time for a lot of these ideas that aren't actually providing care. Most of our care directors spend the majority of their shifts right now providing care because we don't have enough care staff. How can we promote engagement, and what kind of activities are feasible when you're so short-staffed and people are working doubles just to provide basic care?
It's a great question, and it does kind of ring in, kind of that feeling of if we don't access enough, then there's nobody to engage, like, which comes first. And then you can make the counter argument, well, if you don't engage, they're leaving to find somewhere where they feel engagement. And so the cycle continues. I can tell you with, especially in post-acute and across many of our larger, more national kind of programs, they're carving out stepping stones. They're identifying one little thing to try to roll out and have some continuity with it. So even if, everything that we talk through today, and there's no shortage of other, programmatic type stuff you can do, but taking a moment to try to find something and stick with it goes a long way. And those little things send a very powerful message of you're trying. And I think one of the biggest risks right now is, kind of that defeatist mentality of, well, we can't do anything. We don't have the bandwidth, we don't have the people, so we're not even going to try. And I think you end up with a self-fulfilling prophecy of you kind of get what you invest in. So this is an investment. It is something that the leadership has to kind of think about and say, what are we wanting to prioritize? What do we want to stick with? And pushing and holding it and trying it for long enough to see, will people react? And then maybe thinking about another little pebble. You don't have to move the mountain overnight. It can be one pebble at a time. But I can tell you, and many of you on here, maybe we're working with you, start with a pebble. And so I don't know who asked the question, and I know that this is a little bit more of an aspirational answer, but it's also a mindset of you can't not do something.
And just to piggyback on what Rob said, and I think, I agree with everything. And I also agree with the reality of it is so overwhelming when you're in the weeds. And I was recently listening to a speaker talk about, we're kind of in this COVID renaissance where we're all realizing things weren't great before. Things definitely are not great now, and things are not, projected to be great in the future. And so what this is doing is it's giving us an opportunity to take these kind of idealistic programs to the top. Because I think that's important too, is that you've got to get the buy-in all the way from the top, because you're right. If it's just director of nursing, or if it's just the care staff that wants to implement these things, they likely won't be successful because you don't have that buy-in all the way from the top. And so one of the things that, I would encourage you to do is take it to the top, so that you can get that support and, simply find out, like Rob said, something simple, because again, the idea is to keep it simple, because healthcare is just complicated anyway. We don't need to make these complex engagement programs, but use this unique opportunity now, because I think you'll find a lot of the executive levels are listening. They're ready to listen. Whereas before, maybe 5 years ago, if we came with these programs, we might have gotten a little maybe, or, you can, if you guys can figure it out, but you wouldn't have really had a lot of the support that you need. So utilize this opportunity, because it is projected to be a small window, and it will likely pass, where we will start getting into doing things the way we always have once we kind of get out of this window of change. But that's a great question. And
so we have an example that came in of something that a facility did for their employees. It says, we did pantry bags with stuff for lunches, quick dinners for folks to take home at the end of their shift to thank them when they were having when we were having staffing challenges.
That's very cool.
Yeah, that's really creative. I love that. And whoever that person is, are you still doing it now, or is this something? What was the feedback you got from your staff when you implemented it? I'd be curious to hear. You don't have to tell us now. We have our emails. You can email me, but I'm just curious to hear how that program's going. That's really cool.
It says they did it about 4 times over the course of 6 months.
Awesome.
And I have to say, from sitting here at the association and just seeing what everybody's doing, on social media, the pictures and the, just some of the activities that they've done during COVID, I've been really super impressed. Just thinking outside the box, taking a situation that is far from ideal and just doing things that, they wouldn't have even thought of doing before, but just making things work has been really impressive.
Wendy, you just reminded me, one of the things that we come across pretty frequently is organizations are doing amazing things. But what we're not, as an industry, doing a great job about is telling the story. We're not maybe the most up to date on how best to brag about some of the stuff we're doing and kind of remind our employees, that what we're doing and kind of put it out there. And so sometimes it's just the storytelling or getting that out there. And this care, all of our care staff can go work at Costco, for $16 an hour now minimum wage, and not have to change bedpans and other things. And so this competition is not just healthcare organizations, but what are we doing? Like, are we reminding them of the stories of our residents and of the good work that they're doing? And are we telling them the stories of how we as leaders are trying? We're trying to put programs in place, and we want their feedback. We want them to help us understand, what would be valuable to them. And so, we didn't include it in this webinar, but sometimes, being the, you can have the best idea, but it's the best kept secret in your own organization.
Mm-hmm.
Yeah, agree with that. And I know at the association we were highlighting positive stories. And again, if you have them, send them to us, and we can always use them on social media. I think it may have gotten a little bit lost during COVID as we were just trying to, keep our heads above water and stay on top of all the information and, keep our members informed. But, we do ask that anytime anybody has a story, and sometimes I think, in going out, I don't get into facilities as often as I'd like to, but about 2 years ago, I got out to a facility, and there was a woman who was going to be interviewed for one of our Hero Award winners. She was going to give just a brief, synopsis of her interaction with this Hero Award winner, and I thought it was great. She was a resident, and she started talking about how she writes books, and I'm like, oh my gosh, she's in her 80s and lost her husband, and she's on like her 5th book, and I was just blown away by that. And again, that's something that I think is really incredible, and we did feature her and highlight her, as just somebody, she had just finished her and was launching her 4th book, I believe, at the time, and had started her 5th. So, again, sometimes I think we don't see things quite, the way maybe, the public would, or people outside of the facility. I think we just, see people for, what they are and who they are, and, that's just who they are. And, I think sometimes it just gets lost. We get tied up and busy in our days, and then, it may not seem as special, but, again, me going in and observing from, an outside perspective, I found it pretty incredible what she was doing.
Fantastic.
All right. Well, I don't see any more questions or comments here, so I think we'll wrap up. Again, I want to thank Rob and Bree for their presentation today. It will be made available. Likely, I'll get those emails out tomorrow. Have a little bit of wrap up to do here today. Don't forget to stay on for the survey. Your feedback is very important to us. And just want to remind everybody that we have a couple more webinars coming up before the annual convention, which is in early October. That agenda for the convention will be released next week, so keep your eye out for that. We're working here, at the association to get that ready and put it out for y'all to see. So if you have any questions, please let us know, and you can see Rob and Bree's contact information, which I will be also providing to everyone through the follow-up emails. So again, just want to wish everybody a great remainder to your day, and everybody stay well, please.
Great. Thank you, Wendy. Thank you, everyone.
Bye, everybody.